Welcome to the Quiet Warrior Show, where we help top leaders find their pathway to incredible success and a lifetime of happiness. Here is your host, Tom Dutta, the Quiet Warrior.
Quiet Warrior. Hey, how do you like those moves, everybody? Welcome, everybody, to the Quiet Warrior Show. My name is Tom Dutta, like butter, coming at you live from Vancouver, British Columbia. Do we ever have a great show for you today? That's actually not my real voice. This is me now. Well, you know, I thought about this, that today the show is special because we have a fantastic guest on. She's a returning Quiet Warrior, Dr. Martha Boone. I have this cool book that she sent me, and I'm excited about it. And I was reading it. I went, wait a minute, she's a doctor. Many don't know that I'm starting my doctoral in Middlesex University in London in September 13th this year. I've always wanted to be a doctor, so hey, I dress for the part. So everybody, I'll tell you a little bit about Dr. Martha Boone, and then we'll bring her on. I'm opening right up to the back of her first book here. And the gloves don't work too well when you're trying to do it in the studio. Dr. Martha Boone is one of the first 100 women board certified in urology. Wow. After 23 years of education, she practiced academic urology for 5 years and private practice for 24. That's amazing. She was named top doc in urology in Atlanta for over a decade. And her first novel, which we had her featured on last time on the show, The Big Free, it fictionalized 6 years at Clarity Hospital in New Orleans. I remember that book, and it was quite the read, especially if you're not from the industry, seeing what goes on. Dr. Boone retired to write full-time and travel with her husband, Jesse. And I've read about Jesse in the book, but I saw him this morning. So let me bring on the screen here Dr. Martha Boone. Dr. Boone, welcome.
Thank you for having me. I'm happy to be here, and I love your outfit.
You didn't think that you'd get this today. Hopefully, when we're all done, you're not going to say, "Tom, start over."
No, you look like a cardiac surgeon.
Hey, there you go. Well, listen, it's great to have you coming back. So I think before we went on screen in the green room, you're somewhere in Georgia. Tell us where that is.
So I'm in an Atlanta suburb. It's called Roswell, Georgia.
Roswell, Georgia. Fantastic. Everybody, I was telling Martha that for 7 or 8 years, I was back and forth to Atlanta, Georgia from Vancouver, West Coast Canada, because of work I did. And so, Martha, today is really special. It's about storytelling, but there's a pretty cool book that you've just written. We see the picture there. Why don't you hold it up and show us that and just read out the title to us?
It's called The Unfettered Urologist, What I Never Had Time to Tell You in a 15-Minute Office Visit.
Wow. And now, everybody, if you haven't read some of Martha's work, this lady does some incredible writing, but there's a little bit of humor in it. I love the humor, by the way, because I have this dark sense of humor. And I think anytime we can chuckle, it makes our brains release good chemicals that make us feel good. So I'm going to put you on the spot. Everybody loves an author reading a passage from their book. There's a passage in here about you doing a medical exam of a young woman. I should have got you to cue that up, but can you find that in the book there? And while we're doing that, everybody, what we're going to do is we're just going to have Martha read that. And everybody loves a good book reading. Now, Martha, just pretend, and everybody visualize now. It's like, the Twilight Zone. So you want to visualize being in a bookstore, and she's sitting and she's reading that part. So, Martha, I'm going to spotlight you, and you can just read that part to us, and then I'll come back and we'll chat.
Okay. We're in the chapter entitled 3 Doctors in One. Before I fully realized my need to be 3 doctors in one, I had a few shocks. One day I was performing a vaginal exam on a 22-year-old who clutched her phone as I explained what was going to happen. I don't know when everyone began clutching their phones, but I was familiar with the behavior. It reminded me of a pediatric patient holding their favorite doll or bear for comfort. People her age held tight to their phones at all times. I thought nothing of it. When I was sure she was comfortable with the planned pelvic exam, I moved to my rolling stool to position myself between her legs. My nurse made ready the ubiquitous KY jelly. I was gloved, sitting at eye level with the entrance of her vagina, and completely focused on discovering the cause of her urethral pain. I explained what I was doing before I did it, and she seemed relaxed about the experience. As I pulled my gloved finger out of her vagina, her crotch exclaimed, "What did you find, doctor?" Entranced in my deep focus on the source of her problem, I imagined her vagina was talking to me. I was so startled that I pushed back quickly, jammed my rolling stool against the wall behind me, and slammed my head into the wall. As my head bobbed back into position, the vagina continued to talk, as if nothing strange had occurred. When I gained my composure, I realized this young woman had me on FaceTime with her mother. Her mother had been watching me perform a pelvic exam on her daughter. I was speechless. I felt disrespected and violated. I was no longer the trusted expert. Without realizing it, I had become a new kind of doctor, and the expectations of me were nothing that I understood.
All right, I'm going to come back on the screen, everybody. Boy, for all the men that are watching this, and when I read your book, Martha, first of all, I love the way you portrayed that and the humor. It's absolutely amazing. The other thing is, what I think you're a great author is when you can put the audience in the journey, they call it, into the story. I've never been in a room for an examination, but I was there, and until you read what was really going on about the thing that was causing that vagina to talk, I just was like, oh my God, this is an R-rated book, but I couldn't put it down. This is a perfect segue to give it back to you and have you take us back, and then tell us about Three Doctors in One as well. Take us back to why you got into this profession and why you started doing this, what you're doing, and then why you wrote that book.
So I went to medical school thinking I was going to be a family practice doctor and join the Peace Corps. I was one of those young, save the whales, Peace Corps kind of people. And when I got on surgery rotation, all of a sudden I discovered I had really good eye hand skills. The professors were like, wow, you're pretty good at this. And it was easy for me. So I started looking at the surgical specialties, and I thought I would want to be a hand surgeon. So they recommended that I sign up for surgical subspecialties. Well, they had a lottery, and I ended up in urology. And I was in the dean's office just having a fit. I was like, I will go anywhere but that urology service. I don't want to be on there. And he said, I'm sorry, we had a lottery and you lost. So for the next month, you have to be on urology. And I was shocked at how much I loved it. It combined big surgeries. It had children. It had middle-aged people. It had older people. And we did office work. We did clinic work. We did small procedures. So it had absolutely everything. And then one day I went into the chairman's office and I said, I think I'd really like to be a urologist. And this very staid New England man looked straight at me and said, well, honey, you're a good student, but I'm not really sure urology's ready for women. And I walked out of his office and I was like, they need some women. And so I kind of thought I was going to be a urologist when I walked in, but when I walked out, I was like, oh, I am going to be a urologist. So that was kind of a pivotal moment for me.
It really is, and thank you for telling us that. That's for those who came on the first show, Martha. I don't know if you remember, it was a while ago. People can go and find it, the Quiet Warrior Show. The first interview where we talked about your first book. What was the title of your first book?
It's called The Big Free, and I just happened to have
show us that one. There you go.
The Big Free, and it's a novel loosely based on my first 6 months as a general surgery resident at Charity Hospital in New Orleans.
That's amazing. If you remember, before you came on the show, we talked about your childhood, your youth, and growing up, and sort of the seeds that were planted. And you really were sort of not a rebel, but somebody who really fought for the good and fought to help others. And I just saw your body language. Everybody, did you see the inflection in Dr. Boone's body language there when she said, "There's going to be a female"? And I think that's the world. I'm proud of that. The world needs more female leaders. So that's pretty awesome. I'm going back to my copy of the book here. And everybody, I'm just going to announce that I've done a 5-star review for Martha's book. I've read it twice. And she even signed it for me. So if you want to get your copy, make sure you follow up. And again, I'm in Vancouver, Canada, so the book now officially has landed in another country. I'm just going to read something off the first chapter. I like the fact that you've organized the book with little quotes. And then each chapter has a purpose. The first chapter is Never Enough Time. And I'm just going to just read just a moment out of there. Never enough time. The quote is, the two most powerful warriors are patience and time. And I think that the premise of your book has something to do with there was never enough time for me to do something in 15 minutes. So can you just talk to us about that in the first chapter?
Well, I think that the medical system is a little broken, and neither the doctors nor the patients are particularly happy. And so each year we spend more and more time filling out paperwork and doing things on a computer and less face to face time with the patients. And so I had started my career long enough time ago that I enjoyed having 30, 40 minutes with patients. And towards the end of my career, it was 15, 20 minutes at max. And there are just so many things to share with a person when you're trying to help them with their health. I mean, being a surgeon and having the privilege of having someone be put under anesthesia and allow you to cut on their body is just an amazing privilege. And it requires trust on both sides. And so in 15 minutes, it's very hard to establish a relationship with someone where you can get that kind of deep trust. And there are all kinds of things outside of conventional medicine that patients want to talk about. And so I often felt that there was just not enough time. And I know the patients felt the same way, because there were many times when I had my hand on the doorknob thinking about someone who was bleeding that I had to go see. And the person I was standing in front of did not get everything that they wanted. So I think on both sides, there's just never enough time.
I think it's such a blessing, this book. And everybody, we're here in the studio live. We're actually live streaming on Facebook, YouTube, LinkedIn, and Twitter. By the way, if you're on the feeds, please put a chat in the chat box. I'll be able to see it. We can put it on screen. We can communicate, and that'll be part of the live production. I want to just thank those who are on right now. This will be released, by the way, Martha, as a podcast and a live YouTube premiere after today sometime. But I wanted to go back to that because you know a little bit about my story. In 2018, I fell on my head in a bathtub and I had a brain injury. And I remember going back, and I don't go to my MD much, but she's wonderful. She's a European lady. She's really a baby doctor. But going in there, the visit kind of went like this. It was like I got put in between because she's so booked up. And I read something in your book that inspired me, because you talk about how the pressure of doctors just to get their patients in. And so then I get there, and here I am. I've got my head ringing. I've got double vision, all these things, and I'm waiting an hour and a half. We finally get in there, and it's like she takes blood pressure, talks to me a bit, turns her computer, puts some stuff in, 15 minutes. Here, you got a concussion, go get a head x-ray. And to me, there was no connection, and I just felt like I felt lost. And then part of me said, well, to be fair, like you said, taught us, Martha, I couldn't expect Margaret to spend a half hour with me. And so what I really like, what Martha said in her book, everyone, we'll give it back to you to talk about 3 Doctors in One, that chapter, is that you seem to want to connect and get to know your patients in different ways. And you seem to have done that. So why don't you tell us about that, and tell us about that 3-in-1 Doctors.
So when I first became a surgeon, the patients just came to me as an expert. I was a trusted expert. They didn't really ask a lot of questions. They just expected me to come up with the answer. And so in my later years of practicing, the people who were probably 65 to 70 years old and older, they were still working on that model. They wanted an expert. They felt that I was like their lawyer or their tax guy. They brought everything in and they expected me to come up with a solution. And they really didn't offer much back. Then the baby boomer generation, kind of the group from about 45 to 70 now, they want a trusted partner. They respect my intelligence and my education, but they feel that it's their body and they want to make the final decision. And this is my age group and probably the people I've felt most comfortable with. And we would go through all the options, and sometimes they would immediately do what I suggested if it felt like it was the right thing for them. And sometimes they would get another opinion, or sometimes they would talk to trusted other advisors. And then the younger generation, they research everything on the internet. They have ideas of what their diagnosis is, and they'll bring in, everything that they've looked up. And if you don't comply with what they think they've found as the answer, and you don't give them the test or the drug or the procedure that they've diagnosed themselves to need, they will frequently get on the internet and say terrible things about you. And it was a fascinating thing for me because they would walk by my wall of 17, 18 diplomas and not even look at them, but they would trust a complete stranger on the internet. So it took me a little while to understand how to partner with that generation. And I actually learned a bit from them because they would research things and bring in ideas that I might not know anything about. And so by the end of my career, I felt like I had to be three doctors in one.
Wow. That's amazing, and you evoked my brain's going on a journey somewhere else now. That it's interesting because long ago my wife Anna, amazing, my wife Anna, 28 years, will be married in January. I just love her. Her mom had a stroke, and so I remember Anna going to the doctor's appointments. But Anna's was, even at her age, later part of her life, she was a mature woman. She was on the internet getting information and her brothers and everybody's opinion. And I never really thought about the perspective being in the doctor's shoes. And everyone in the book that Martha was talking about, if you read it, it really opens my eyes to how do you deal with that as a doctor without, putting your ego first and losing your patients. And you've done a really good job. I want to talk more about the book itself. Martha, throughout the book, you picked certain topics to talk about. One of them was blood and urine. Just tell us about the concept of the book. What are you trying to do with the way you've organized it?
Well, I wrote the book, in essence, to be a love letter to my patients. I wanted to thank them for trusting me and for being my patient. And I wanted to make sure that they had the benefit of all the things that we didn't have time to talk about. I'd been retired about 18 months, and patients were still calling me, and referral doctors were still calling me. And I saw a pattern. There are so many excellent urologists in Atlanta, but they didn't really need someone to interpret the science. They could get that. But what they wanted was my intuition. They wanted my experience. They wanted my think outside of the box. And they also really missed my willingness to listen to the things that they were concerned about, even though in my scientific brain they may be silly. But they wanted to understand why I thought that those things mattered or didn't matter. And so I wrote the book to address all of those concerns and also to kind of be, an end to my career. Yeah. And so the book is divided into it's got an element of memoir. It has some funny stories in there and it has some terrible stories, but it also has a lot of scientific information, and it has things that are mostly intuition and alternative medicine. And I also wanted to help keep people out of the doctor's office if possible, because healthcare is so expensive and it's so aggravating, like you experienced, sitting in a doctor's office for an hour and a half waiting for a 15-minute visit where they send you for a test. And so through reading the book, almost as like a reference, looking up the topic that you have a problem with, Yep. It can help you do things that you might avoid a doctor's visit or avoid expensive tests.
Yeah, everybody, teaching moment there. And you mentioned a word that triggered me to go back and think about, again, the book. Everyone, we're here with Dr. Martha Boone, who wrote the book. She's holding it up now. the Unfettered Urologist. I got my copy here. And one thing you said about intuition, and the reason why it twigged because I remember reading a thing in the book there about somebody who had testing done, and I think you knew them, everything was clear, and then all of a sudden you had this intuition and you went with your intuition. Before I give it back to you to tell us about that, and if you want to refer to the book or just talk, I want to mention that I'm deep into neuroscience because of my recovery from a brain injury. And one of the things I'm learning about is the whole concept of this intuition. And I just want to say, from my sector where I work as a CEO, I remember it was actually a funny thing because you live in Atlanta. I was the head of a company with a sister company there, and we were having to outsource and terminate a group of people to move the business from Canada to there. And I remember Martha saying to my wife, I had a lot of challenges with this decision. And as I listened to staff and people and the bosses or the boards who were putting all the pressure on me as a CEO, I wouldn't sleep at night. I had this gut feel. It was intuition that there's something wrong with this. And it turned out, and my wife says to me, she said, Tom, you're very intuitive and you're usually right. Well, we made this change. 3 months later, it came to truth that it was not the right change to make. So tell us from the book that little nugget story about intuition. I think you know the one I'm talking about, right?
Yeah.
Yeah.
So all throughout my career, I would get strong feelings that I would call my intuition, that something, should be done a certain way or shouldn't be done a certain way. And if I ever had a strong feeling that I should not operate on someone, I would ask them to get another opinion frequently. But I think the story you're talking about, a trial lawyer came to see me to just be evaluated for prostate cancer. He had no symptoms, absolutely nothing at all. And his examination and all of his testing was completely normal. But I had this overwhelming feeling that the man had prostate cancer. And I didn't tell him that at the office visit because I thought I have nothing on which to base that. Maybe I'm just hungry. Maybe I didn't sleep enough last night. And so that night I could not sleep. I could not get comfortable. And so the next day I called him and I said, this is going to sound completely crazy, but I think you have prostate cancer, even though none of your tests point to it. And there's not a single urologist in town that would recommend a prostate biopsy, which can be painful and sometimes even dangerous. So I'm just telling you, I've got this intuition, so you'll know what to do with it. And he said, I'm a professional also, and sometimes I have intuition, and I'm going to get the biopsy. And he had prostate cancer, and it was at a stage where he could be cured. And I sent him to one of my friends who's a great robotic surgeon, and he had a prostatectomy, and he's 10 or 15 years out now, and as far as I know, cured. So that was just an example. That's a very dramatic one, but I think all of us get those little nudges on a daily basis. And if I were a patient who went into a doctor's office and I just did not feel right about the doctor, or I did not feel right about whatever they were telling me to do, I would consider getting another opinion, because a lot of times we trust experts too much. And just, make sure.
Yeah, thank you for sharing that. Getting another opinion. I would imagine there's some doctors out there that may be a bit uncomfortable when a patient says, I'd like to have a second opinion. Hearing one you just got from Dr. Boone, who's very, very qualified in her field, that it's okay to ask for that. The thing about the intuition part, where is that showing up in other parts of your life? Can you think about any other circumstances outside of your work where you had intuition about something and you followed that?
I think I have little snippets of it all the time, but I think I really honed in on it at work, because I would spend 10 to 12 hours a day at the office and at the hospital. And so I think most of my skills revolved around my work life, and I think that's where I would pay most attention. But I'm sure, I've had it in other ways. I can't think of anything right this moment, but I think it's kind of a big part of my life all the time. I just focused on using it mostly at work.
And there was something in the book I read about how this actual, I honored and everybody, we congratulate Dr. Boone for retiring now and being a full-time author, writer, and sharing her wisdom. But this wasn't when you planned the retirement. Apparently it was years ago. Just tell us a bit about that, how this whole idea of, retiring happened, and there was a change in plan because of something else.
So I was one of the few people that remained in solo practice. And what the big deal about that is that I would be on call for my patients 24 hours a day, 7 days a week, except for about 4 to 5 weeks a year where I would hire someone to cover the practice. So I was working basically all the time, and I loved it. I mean, it was the greatest thing. I absolutely loved it. But I wanted to travel. I wanted to go and see, how do other people live? What do they eat? How do they raise their children? What kind of religions do they have? I mean, I wanted to see it for myself. I didn't want to live the world only through books. And so I could not get a block of time off to actually do that. So I was going to close my practice for a year and go travel the world and then open back up. Well, of course, I chose the time that COVID hit. So about 2 months after I went on what I was calling a sabbatical, COVID hit. And so all of my travel plans were rescheduled about 3 times. And by the time I finally got to go travel, it had been almost 18 months, and I decided not to go back. So it was a bit of a staged thing.
That's an amazing story. Everybody, we tell stories on the show. It's really the hero's journey. And I wonder when you said that, because it evoked in me some thoughts about what happened with my business. Everybody, just think about when COVID hit. If you are in a business, did you have to pivot? Did you have to go digital? And this brings me to a question that maybe isn't related to the book, but if you can share your thoughts. That now when I see I had, because of my mental illness through my concussion, for the first time in my life, I had a psychiatrist working with me, who I love, by the way. I think everybody should get a checkup from the neck up and have a psychiatrist on your care team. Because as a high stress life I had to change, Martha, you can't walk that alone. But all of a sudden, COVID hit, and I get an email saying you're now meeting through this digital platform. So for a lot of us, so now there's 2 assessments I do before I meet monthly called GAD, which is for depression, anxiety. And then boom, he pops up. He's in his room. And this is just really funny because I'm a Canadian. But you have a wonderful background in your studio there. I get on this call with my psychiatrist, Dr. Ron, who I just think highly of. And he's got a picture of the White House in the background. And the brain kind of sees things, takes it, and then has thoughts about thoughts. And I'm going like, I don't want to see that right now because I'm already depressed. I don't want to see politics. But we meet every month, and it's through digital. So let me give it back and ask you a question. If you had to, could you take the work you do, which I doubt you can because of the way you have to do examinations? If you had to do something digitally, could you do it in your profession or in order to diagnose patients?
To a urologist, this is digitally. So there's some things we could talk about. Like if I had actually examined the patient in the last 3 or 4 months, we could probably do some visits.
Okay.
But we were actually able to get on a digital format within 24 hours after we were told that we couldn't see patients in the office. And so it was fascinating because a lot of the older patients were not used to this at all. And so I would be talking to the husband about refilling his little blue pill, and the wife would be walking in the background with the cat going, doing this. And so it was a completely different format. And the IT person who was helping me do all of that, he was not used to urology questions. So he got a shocking education while he was trying to get my computer all set up and ready to go. But we did it. We did it.
That's incredible. So it sounds like you would still have to do a physical exam somehow, but you could meet virtually, or you did, as you progress through things. Let's everybody. We're with Dr. Martha Boone, who's written the book, well, many books, but The Unfettered Urologist. Can you hold that up again on the screen? We want to screenshot it. Wonderful. Let's do dueling books. So there's mine, and I'd like everybody. I'm going to do a shout out. If you could please get the book, because author's work isn't known, even though Martha is known very well for her profile. How we get known is when you read the book and then go to Goodreads.com, Amazon, wherever you buy it, and post a review. Choose up to 5 stars, but post a review. That helps the word get out and people get that book. I think personally this should be a book that's a resource book on every human being's library, only because is what, Martha, you've been teaching us. It's got things in there. Like the first one, if you see blood in your stool or in your urine, that's a very helpful chapter because, if it was me and I saw that, I'd be really honest. When I read it, I thought, what would I do? And I might write it off for, you know what, I'm so healthy. But you told us that there's some flags there. I was thinking back 15 years ago. I picked 15 years for a reason. You'll find out why. Can you remember what it was like in your office, actually just doing an exam or explaining to somebody about the woman about her body and sort of infection? Do you remember those times when you're in the heyday? What was it like? Put us in that room. How did it feel, with your patients? I mean, did time stand still? Was it just one of those things you could just do it all day long?
So time stood still for me when I was doing surgery.
Surgery.
Yeah, the operating room is the most amazing place. People don't realize you have a team. And I was always very, very lucky to work with wonderful nurses and techs and great anesthesia. And in urology, we rely also on radiology. So I had wonderful teams. And I guess it would be what athletes experience when they call getting in the flow. So even, if it was a hard case, sometimes it was an easy case. You didn't know exactly what was going to happen because everybody's body was different. And, it was always cold in that room and you could keep it quiet or play whatever kind of music the patient would like. And, we would just be doing a task and there would be nothing else that existed during that time. And it was the best talent I've ever had in my life, but it's not the kind of thing you can show other people. You can't go, hey, watch me do a kidney transplant, at a cocktail party. Nobody wants to see your video. So, it was amazing. And I really miss that part. I miss the nurses and the techs. And, when a patient lays on that table, it is a bit of a spiritual experience because you know that you are pulling everything that you've learned and your focus to their best benefit. And the look in their eyes when they undergo that anesthesia and they trust you, I mean, it is an amazing experience.
You just taken me back into a place I've never been. Again, I've got the book here in studio on my live other cam. As I was reading this, I read something about doctors and lawsuits and lawyers, and it's a highly litigious profession. I think in Canada, not so much, maybe is. How do you deal with that when you have your heart and your passion and you're doing life work to help somebody, but in the back of your mind, about some of these other things? How did you deal with that?
So I think our legal system and our medical system have a fairly dysfunctional relationship in America. I really respect the legal system because I think for the most part it works fairly well, but it's overly expensive. And for medical problems, it takes way too long for the patient to be made whole. So if we know that we're human beings and we know that doctors are going to make mistakes, and we know surgeons, because of the nature of our job, are going to make some dramatic mistakes.
Yeah.
And so when we make them, there should be a way to make the patient whole. But what happens in America is we have these lawsuits that go on 10 years, long after the patient should have been made whole. And it's almost like a lottery. If the jury likes the patient, then they get a chunk of money. And if the jury likes the doctor, then they don't get anything. And it's not very functional. The way I dealt with it was I just decided to ignore the whole thing. Whoever showed up in my office, I tried to take the absolute best care of them that I could. And whatever happened was going to happen. And, thank God, I didn't have problems. Quite admittedly, a whole lot of it is my team. I mean, I never had a major anesthetic complication.
Wow.
I never worked with a nurse or a tech who wasn't good. And, a lot had to do with the system. I mean, in Atlanta, we have several major hospital systems. And the last one I worked in was Northside. And my God, the quality of care was just amazing. So a bit of it was due to my great Tulane training, which I'm a big Tulane and Charity Hospital fan. But a lot of it was, the team. And some of it was luck.
I like that. The team, luck. I mean, it sounds even parallel to being a business leader. If you're running a company, you rely on all those things. I have such respect for you about what you do in the OR. I mean, I got to tell you a quick story, Martha, that my daughter is 24 now, and I'm not a clergy, by the way. This is not my,
I liked your other costume better.
I'm baptized Catholic, and I'm practice my faith of Christianity. It's done many things for me while I'm recovering from a concussion. However, my daughter's 24, Martha, and I haven't seen her a lot because she's on the other side of our country, so that way, which is called New Brunswick, Canada. And I'm in the West Coast, British Columbia, which is a beautiful place. And the thing is, she's in fourth year university, and I don't really see her a lot. And I have these worries and feelings. Is she going to get good medical care? Is she going to be looked after? And at some point, you get to a point when you're a father and a mother, where your children grow, and you just let them go, and you hope that they pick up. What advice do you have for my daughter who had our family physician and now has to go out and develop her own team of care providers? What do you say to young people?
So I don't know the Canadian system very well. In the United States, if you live in a major metropolitan area, there's a good doctor or nurse practitioner or a PA on just about every corner. I mean, we have a lot of good primary care doctors. We're really lacking a lot in the surgical subspecialties. But, if she had a nurse friend or knew someone who was in nursing, they will usually tell you who the good people are. And then if you find a good primary care person, then they can direct you to any kind of specialist that you might need. But I would also encourage her to use her intuition. If she feels that someone's not the right person for her, look for someone else. If you're in a small town, a lot of times, a lot of the specialty doctors are not readily available. So I think you just have to ask around, and nurses are a good resource. I would encourage her to be careful about following reviews on the internet, because so much of the time, the happy customers in a doctor's office, they don't take the time to write anything. But anyone who's not happy will say terrible things. And sometimes it's people who want drugs that you won't give them. Sometimes they're unhappy because they didn't understand their bill. So I'm not really sure that this is a service industry that I would trust what's on the internet too much. I mean, unless you see a trend where it's the same thing over and over again.
I thank you for showing that. I got a comment on the screen to share. It's a great comment. We'll read it together. Why don't you read it out loud?
Martha's confidence and intelligence balanced with her humility and appreciation for her team members. Oh.
Yeah, that's wonderful. Thank you for sharing that, Janet. Obviously, we have several people watching live right now. That is something that comes out of you. It's this humility. Certainly not arrogance. I could see having you as my doctor anytime. I think this thing, though, we're authors, by the way. I'm an author of several books, and we have something called trolls. And you see it with restaurants, Martha. And these people, they have nothing to do. They just troll and they put stuff out there. And you know what? I agree with you. I think the best referral for a doctor is what we call being referable. So, who do you know? I know Dr. Martha Boone. Check her out. You can go do all your research, but talk to her, check her out, and talk to some of if she could let you talk to any of her patients. Thanks for sharing that, because I think the next generation, the Gen X, Gen Y, the not the boomers, but there's a term for it. It escapes my mind. They have a very, very different approach to life. They don't want to go in and stand in line in the store. They like to do things because they like to work hard, play hard. So get my stuff from Amazon, get my banking online. It'd be very interesting to see how the profession changes. I want to do something here just to take you back 15 years ago. That's why I asked you the question. There's always a method to my madness. But while we're doing that, because I got to set something up, could you pull the book out and how about this, Martha? Is there a chapter in here you want to talk a couple points about to people? If not, the one that caught my attention again was chapter 15 on toxins. It's actually at the end of the book. I thought it was kind of interesting about how you talk about how the body removes toxins. But choose anything, and while I'm setting this other thing up, we're gonna let you just talk to the audience. How's that?
Okay, that sounds good. So the body is brilliant, and if we just give it what it needs, most of the time it will take good care of us. And what does it need? It needs a good night's sleep. If your partner tells you that you're making a lot of noise when you're sleeping or you stop breathing, please see your primary care doctor and get a sleep study, because quality sleep is so important to our health. What happens when we don't have quality sleep is our cortisol levels go up, and then we store fat at a faster rate, and we become more predisposed to type 2 diabetes. The other thing the body needs is quality food. If you can't pronounce it, if you're looking at a box and you can't pronounce any of the ingredients, then that's a pretty good sign you should not eat that. The more whole foods we can eat, the more organic food, without the pesticides, the better off we are. I think that different people need different diets. I think that we have all these trends about food, and I think common sense and paying attention to what your body likes and needs is probably the best thing to do diet-wise. And as far as exercise, the body needs movement. We have to keep moving. And so you must find some type of exercise that you like and do it. As far as toxins, our body is able to release things that are not good for it by breathing them out. So we breathe out toxins. We can sweat out some toxins. We can defecate or have a bowel movement and release some toxins. And we can urinate out liquid toxins. So the body knows how to do all this if we don't present it with too many toxins. I mean, if we smoke or we live in a terribly air polluted place, then we're not going to be able to breathe out enough of those toxins, and the body will become sick. And it's the same thing with what we ingest. I mean, I think the best rule is just everything in moderation.
Well, that's great. I enjoyed listening to you, everybody. I was just off the screen. I'm your host for today with the Quiet Warrior Show, and Martha was talking about the chapter 15 in the book, Toxins. So you got to get the book and read it, give it a rating. I was kind of curious about toxins because in my diet, especially since I've been working on brain health, so just to catch you up quickly, Martha, and I'm not sure if in your practice people you saw had concussions or other injuries or other situations where you could you have some wisdom. With me, I had to go through neuroplasticity to learn to walk straight again, to balance, to speech, and because I landed on my head in a bathtub. And so I've been working hard. I have a naturopathic physician as well, feeding myself with the omega-3 fatty acids, the natural fats that the brain needs. So I don't need you to talk about that. What I'm worried about is there's a lot of talk about fish and toxins in fish, like mercury and things. So do you have any wisdom in terms of when we're shopping and buying products? How do we know, if the fish is safe, or can we?
Unfortunately, I don't know anything about that. And that's something that we struggle with in our house is, how to get good, clean food and what can you trust. So I wish I did know more about that, but unfortunately I don't.
Yeah. I don't think too many people do, but I want to just brag here. I'm not going to tell you for a commercial, but they're my local grocer. I can walk there. It's close. They have a new product. My wife and I love sardines. In olive oil because of the omega-3 fatty acids. I found this new product, Martha, that actually on the box it says no GMO, no this, no that, and it says tested for mercury, and it's awesome.
Yeah.
And so that's all I buy now. So that gives me that comfort. So everybody, maybe that's the thing. You got to do the due diligence, just like finding a good doctor like Martha. Well, I'm going to share something now with you. I hope that you'll get some fun out of this. Everyone, we're here with Dr. Martha Boone in her new book, The Unfettered Urologist. But as I started up front and introduced Martha, the first board certified woman, tell me if I'm wrong, but you've got decades of experience. And I asked you a question a short while ago. What was it like when you were in the room talking to your patients or explaining things like what's in your book about urinary tract infection? So let's go back and kind of take you back in time a bit. And I have a little video here that I want to play. So
about 95% of all urinary tract infections in people under 50 occur in women. This is a picture of the female
Woohoo, what a superstar.
pelvis, as if we have cut the woman in half and we are looking into the pelvis. This is the tailbone, and this is the pubic
okay,
bone.
she just said cut the woman in half.
That pass through the pelvis are the rectum,
She's an axe murderer, everybody.
the highest content of bacteria in the entire body. The vagina, which is a warm, moist area, and the bladder, which is supposed to be sterile. In 95% of all people, the urine is sterile.
It's only a minute, by the way.
Are prone to urinary tract infections. What most frequently happens is the bacteria that live in the rectum track out over the perineum, which is the piece of skin between the vagina and the rectum, get into the vagina, and then some of the bacteria get into the bladder. There are many defenses within the body to correct this problem. The urine itself is what we call bacteriostatic.
Let's have some fun here.
Will kill bacteria just in and of itself. There are also, in the basis of the bladder body, the basis of the bladder neck, there are also cells there that will kill the bacteria. Another defense mechanism that we have is drinking lots of water. The water will pass through the bladder and flush the bacteria out. But a urinary tract infection is when an overgrowth of these bacteria occurs in the bladder and an inflammatory response occurs, and the patient will experience burning and pain and frequent urination.
I just got to put something up there for a second before I ask you. Not everybody was a throwback in time. I know I surprised you, but tell us about, honestly, label it the feeling. What was the feeling and what did you think about watching that?
So that's a perfect example of how if you don't get enough sleep, your cortisol will be elevated and you will store fat. So I was at least 15 years younger, but I was a lot more overweight and my hair was straight and blonde. So I think lack of sleep might cause your hair to be straight and blonde too. Now it's crazy, curly gray, but So it made me miss talking to the patients, and it made me realize how Southern I am. I remember when I sat for my boards, my boss said to me, he goes, "Now you're going to have a bunch of New England guys who are going to be, studying you, and you need to keep that magnolia mouth under control, because even though you're really smart, they're going to think you're stupid because of the way you talk."
It's always fun watching yourself. I do executive coaching too in my education practice. And I always tape people and have them watch it back. And a lot of people haven't seen themselves like that. I know you do a lot of media and you have stuff, but I can't quite figure out who. But Martha, I'll be thinking about it. And when I finally get it, it'll be like in the middle of the night, and I'll be going like, oh yeah, because that reminds me of somebody. It's somebody I've seen in a movie or somewhere on TV, that image of you. But I want to do one other thing here, and I'm going to just put myself on the screen, another screenshot here. Everybody, this is a live cam, and what I want to point out in Martha's new book here is that I think the book, when does it release officially, or has it?
It came out on the 15th. So
15th.
It's been out 2 days.
Perfect. Yeah. Awesome. So what you see in the front, there's many pages of, we call it early praise. Here it's called Unfettered Urologist Endorsements. I want to read this one here and announce that and make a call to action, everybody. So let me just check something on my thing here. Okay. So brilliant storytelling and raucous humor, Dr. Boone's take on urology is an unexpected total reading experience, masterful, uniquely written with insider information, a published work worthy of every man and woman. Tom Dutta. That's me. So I'm honored to have read even the manuscript before. I put my wrong sound effects on there. Let's just. I'm laughing. That's the one. So I think what we'll do is we'll keep that in, because we went from, giving you the boo bird to crickets, to me finding the right button to push. And you saw that. So everybody, that's what happens in a studio. I can't see with these glasses as clear because of my vision issue. So I wanted to give her an applause. I'm putting on all the stupid things here. But let me just go back and show one more thing I want to just put on the screen here. So just hold on, Martha. All right, there it is. We're going to give some fireworks for Dr. Martha Boone's new book that's out. There's lots of praise in it. So Martha, why don't we give it to you for the last word, and tell us where can they get the book and how can they reach you, and then what's your last words to your audience today?
So I love to support independent bookstores. So if you go to my website, my favorite independent bookstores listed there. And also it's everywhere. I mean, I've even seen it on Walmart and Target and, Barnes and Nobles and Amazon. So just look on my website and you can see us pretty much everywhere.
Awesome. And you see the stock ticker on the screen, www.marthaboone.com. Maybe in your next book, you can write, for me anyway, this story about if you've ever been examining a vagina and a book's come out. Oh my goodness. Everybody listen, I would never say something like that on a live broadcast, but go read this book, because she talks about a talking vagina at the beginning. So that's what makes this book so fun, because it takes a serious topic. Hey Martha, I just want to do one more thing to honor you, and we're going to put on the screen here that in the background everybody can see. When Martha was on the show the first time, we inducted her into what we call the Quiet Warrior tribe. And people who come on my show who tell their authentic story, put their ego at the door, but also tell their gut punches, their traumas along the way, and have taken what their life story is from childhood and turned it into something for good. We award them. So on the screen is an award. It's a challenge coin, and it's actually an actual coin. It's minted and hand-painted, crafted. The back of it has an image of what we call the hero's journey. And I think because of COVID and mail, we didn't get yours out to you, but you are a member of the Quiet Warrior community.
Wow.
There's about 200. I've done 270 interviews since I launched this show, and there's 270 coins in a world of 8 billion. And so everybody who carries one, these were started in World War I, actually. Soldiers actually used to carry them in their pockets to create community. So if you didn't have yours, you maybe had to buy drinks or the officers club. But around the world, they're used broadly now for community. And so when you hold this coin in your pocket, just know that you are connected to about 260 people and growing who are really quiet warriors doing amazing work. So congratulations.
Thank you. Thank you.
All right. So any last words for you before we move on and till next time?
It has been my honor to have meaningful work, and I hope that the book helps someone. And thank you for having me here. I appreciate it.
All right, that's awesome. So everybody, like you heard from Dr. Martha Boone, like you're going to hear when you read the book that she's written, find that true passion within yourself, find the true purpose to help the world, and live the life that you deserve and desire. Look for this broadcast being released as a podcast and a YouTube premiere video in the next little while. We'll see you all again. Thank you, Martha.
Thank you.
Thank you for listening to The Quiet Warrior Show. Create is a motive-based leadership development firm. www.kreat.ca.
Hey, everybody, just getting in my chair here. Forgot to put my headset on. You're in for a treat today, everyone. All right, we are live. Let me start my music here.